So now let's talk about thighs and legs. And so when we're talking about thighs and legs, we want to look and make sure, does our mom have any redness, hot to the touch? Does she have a complaint of when she stands that she has pain in the calf area? We want to ask, any issues with walking? There's a round ligament that is located right at the base of the symphysis pubis on both sides, and that is called a round ligament. It's the ligament that holds the uterus. So as the mom progresses in her pregnancy, the uterus becomes heavier and heavier, and sometimes in this little inguinal area, the patient can have really, really bad discomfort and pain, and it can be pretty significant to where maybe she needs to take Tylenol or maybe just kind of be on bed rest through the latter part of the pregnancy. So we always assess that with legs and thighs. Also, we're going to check to see, does she have a positive Homan sign? So we dorsiflex the foot. Any pain, Miss Anderson? And if she says no, it's all good. If she says yes, then we have to do further investigation. And usually when we do a Homan and we dorsiflex, the pain that they feel usually is a shooting calf pain. And they may have complained of some redness or some shortness of breath, or they may have felt heat in this area. So definitely need to further investigate. One of the things that a physician could do is do a Doppler study of the calf to make sure that all of those vessels are nice and open. We don't have any blood clot there. Also, when we're doing the dorsiflex, we also want to check to see if the patient has any clonus. And so as we dorsiflex all the way, we want to make sure that there is a true transition and it's smooth back to the normal position. If we dorsiflex and we have this, that's considered clonus. And so normal beats of clonus would be about 4 or 5 that we can live with. But if we have dorsiflexion in this, that represents that this patient is having some neurological issues, and usually it's preeclampsia. And we'll talk more about that in class. So those are the two things. We're dorsiflexing. Any pain in your calves or legs, yes or no, and then we're looking for that smooth transition back to the normal position. And we do it on both sides. So that is your legs and thighs. Also, we're going to be doing DTRs, or deep tendon reflex, where we give support under the leg, and we can do this, and we should have how many ever grade of DTR that we're going to have. The normal is 2, and so if we have a DTR, we check, and she almost kicks us in the face, then that is really hyper reflexive. That is an issue. That we're looking at preeclampsia and probably severe preeclampsia. If we have just this, that's the normal. If we have nothing, then we have to look, is this patient on medication that is suppressing or depressing her reflexes? And so we have to do a little further investigation. We all have normal deep tendon reflexes. And we'll go over this more in class, and I'll have you guys to also do it on yourself. And so that's what we're looking at for our legs and thighs, and then we'll move on to skin.